So the last few days, you have heard a lot of politicians, top government officials, etc., talking about AI. I'm actually going to show you that we have developed AI over the last 15 years. So 15 years ago, I sold my company, Asset 4, to Thomson Reuters in New York, and I started working on a health score. So we hired 25 data scientists from all around the world, and including professors from MIT, ETH, etc. So we developed the health score. The health score is today patented in over 200 countries. We have filed over 190 patents. My key motivation was I have 5 wonderful daughters, and I was getting scared that they don't move anymore. They lived on their smartphones. And when we look at this, we see here what's happening. We all eat junk food, and our health insurance costs are exploding. So my mother was a teacher. I grew up in Denmark. And we had to cook in the evening and so on. So at this time, it became more and more normal to add more fat, more sugar to food. And this was back in the 70s. I can't hide my age. But basically, the biggest problem we have today, and you can see I'm not a super skinny guy, and you will hear it later when I start talking with my AI system, is we move too little, we eat super unhealthy, and we sleep too little. So why should you be excited? Because there's a monster opportunity coming. So right now we spend about 1.4 trillion on well-being worldwide. I am saying today that's going to grow at least 4 to 5-fold because of those issues. Healthcare costs are exploding. We cannot keep on building more hospitals and putting more people in hospitals. We need to prevent and predict, and I put this in my first patent 15 years ago, and we need to make sure that the doctors can spend quality times with the patient. So what did we do? We worked on a digital health engagement platform that is scoring your health in real time. We're in 40 different countries. We now have 100 million lives under contract, and we are growing very fast. Today, because I'm here, you will hear it before the world press, we will announce this afternoon that Allianz has chosen Dacadoo. Allianz is the world's largest insurance company. We already have United Healthcare Group. Downstream, we score cancer, we score morbidity, we score COPD, etc. So we basically have this monster stock exchange, and the whole thing is based on Da Vinci's lifestyle principles. You remember he made the drawing with the arms and the legs? Bill Gates paid 52 million for the drawing. I don't say Bill Gates is smart, but I assume so. So we may think there is something about holistic health. So I didn't invent the holistic health, but I invented the health score that enables people to understand their health. Now, behind the doors is a stock exchange. I mentioned before, my first company was the SQL Group, which became Sybase. I sold it to Sybase. It became the SQL server that you all know from Microsoft, and we built all the stock exchanges around the world. So the risk engine is like a stock exchange. It gets billions and billions and billions of data points, scores it in real time based on 400 million man-years of clinical data. On top of that, it spits out confidence interval, risk pricing, and turns in your health to your wealth. So with COVID, everything changed. I have been investor in data science for 35 years and healthcare, but nobody ever invested in predict and prevent. When I founded Dacadoo and said, I'm going to put 100 million into building an algorithm that scores health 15 years ago. Don't forget, there was no Apple Watch, there was no Fitbit. They were all thinking, this guy's crazy. So I promised to tell you a little bit about the evolution we have gone through in data, because I think it's very important. We started with statistic models. The most simple way I can explain a statistic model to you is the calculator. So the calculator that came out of Japan in the 1670s, that was the first modeling we knew. Then came deep learning. Is this a cat? Is this a dog? Is this a sign? And here we can do your blood pressure, as you know, with the face reading. So this is deep learning. I believe the future is about A to A, and I think it's one of the first times you hear this term. So A to A, of course, stands for agent to agent. So basically, we will see, and I will try afterwards over secure gateway to show you what's coming. I mentioned before food. I started when I was a student. I worked at the supermarket, so I'm very close to food. And you can see here, about 30 years ago, there was 0 papers on food. Today we publish over 70 to 80,000 papers on food every year. So this is becoming of key importance. The healthcare industry is the largest in the world. It's bigger than banking, it's bigger than government. We spend over 15 trillion on healthcare globally. But healthcare is sick, and I always get beaten up. People scratches my car and hit my kids. I'm just making fun because I say healthcare is sick. Healthcare, we spend over 80 to 90% on sickness, and we spend less than 1% or less we spend on predict and prevent. So the root cause is not being treated. So healthcare is today reactive care. I break my leg, they operate my leg, they send me home, and they tell me to do a few push-ups. Now we need to get over to a preventive healthcare system. I'm not saying this because COVID came. I started 15 years ago, and today, as I said, we are over in 40 different countries, and all the healthcare systems are changing. National Health Services is bankrupt in England because they spend 90% on treating sick people. They spend 0 on prevention. So we need to change. One of the world's most successful, and this is not my slide, it's their slide, pharma companies is Novo. I was unfortunate to spend some time with them, and they presented the 5D model. Now we could take the 5D model to insurance. We could take the 5D model to healthcare, to hospitals, to doctors. So it's all about, as I started today, integrated data models. Many people say to me, yeah, you have a big mouth and you know nothing, and that's all fine. I'm just joking, I have sense of humor. So today, all of you have one like this. So this is a smartphone. In that smartphone, there's a gyrometer, so it measures your walking speed, it measures your walking behavior. So basically what we do is, we use very advanced machine learning behind, and then we create a profile of you. So we call this smart digital health triage. And when we look at it, The Economist says this is the future of healthcare. It's called quantified self. So today, and I'm not an investor, so I have no interest, this is the world's first mobile blood pressure device. So there is no band on my arm, etc. Why am I mentioning this? Because we still die very commonly of heart attacks. So I hope you get the idea. What I try to do is to predict and prevent before you get that heart attack. I mentioned food before, and when we look at it, obesity, and that was how I started, is unfortunately the largest driver of healthcare cost globally. But there is no prime minister, no minister, health minister in any country that would dare going out and say, England, you are too fat. And I'm extra making fun, and I'm not a skinny guy. So basically, we need to start here. So about 2 months ago, we announced globally the food score engine. So we score the basket in real time directly at the back end of the supermarket. So we have Albertson. Albertson is the world's 3rd largest retailer. They have 77 million retailers. We just announced Holland & Barrett in England. They have about 11 million clients. And we will announce the largest retailer in Asia very soon. So we integrate the food scoring directly in real time into the health score. We would talk about personalized healthcare. So you score the pathways based on the patented health score. We have built ways you can test your blood at home, you can test your health at home. And for United Healthcare Group, which is the world's largest health insurer, we built the AT&T, which is a switchboard, and you know what AT&T, we used to do, plug in the cables so people could talk to each other, of health services. So this is not a dream, this is not something I dreamt of or came up with a year ago. This is 15 years in service. All data is encrypted in rest and transfer. All the data has the highest level of privacy. In 1 month from now, we are coming out with the Instagram of health. So we are building card system where you can configure and share your favorite cooking, your favorite golf game, everything, and it scores your health in real time in the background. We are the only company in the world which is Cool Vendor by Gartner Group, and we are global leader by CB Insights, which is the competition. Groningen is the #1 university in Holland, and we had no idea. They followed Dacadoo users, so it's a public healthcare system in Holland, for 3 years. The first year, they saved 4.9%, and every single year, they saved 5.3%. That's a lot of money, ladies and gentlemen. So in all other countries, you talk about 5, 7, 8, 10% increase. I want to drive down the healthcare cost. I want to give health to everybody on the planet, and that's why I made it. I want to deliver a blood testing that you can do for $2. So now the world premiere, can you take down the screen for 1 minute, please? My sharing.
Hold it at the top. Okay.
Hello, hello? Yeah. So over the last 18 months, we have worked on a top secret project. It is the world's first rack-based LLM coach trained on over 400 million man-years of clinical data and over 5 billion lifestyle data points. We have not tried it, and I'm going through a secure firewall. If it doesn't work, you can see it afterwards. Good morning. Good morning, Coach. I'm here with a lot of people in Abu Dhabi, and I've been, eating too much the last few days. How is my health score today?
Good morning, Peter. Let me check your health score for you. I'll just need a moment to retrieve the latest information. Your health score is currently at 796, which is a solid reflection of your overall well-being. Here's a quick breakdown.
Yeah, just stop, Coach. You talk too much. So, let's look at my sleep. How did I sleep last night?
Last night, your average sleep duration was 7.3 hours.
You can hear it.
Let's dive into the details to see how you slept last night. Last night, you slept for 7.6 hours. Your sleep score was 640, which suggests a fairly good quality of rest. How do you feel about your sleep?
With all those people and all those speeches, I get really stressed. So I think I've gained weight. Let's take a look at my body weight. I really need to lose weight because I told the people I weigh too much. So what is my body weight, Coach, and what would you recommend me to do now?
Your current body weight is 103.8 kilograms, and your BMI is 32.76. To work towards weight loss, I would recommend a combination of the following. 1. Balanced nutrition. Focus on whole foods like fruits, vegetables, lean proteins, and whole grains. Try to limit processed foods and added sugars. 2. Regular exercise. Incorporate both cardiovascular and strength training exercises.
Thank you, Coach. I don't speak Arabic, but, I would just swap over and talk German with you. Hallo, Coach. Sprichst du auch Deutsch? Kannst du mich über meine Schlafqualität erzählen?
Natürlich, Peter. Lass uns einen Blick auf deine Schlafqualität werfen. Du hast letzte Nacht 7,6 Stunden geschlafen und eine Schlafqualität von 640 Punkten erreicht. Das ist
So it knows everything about my health. It has my biometric data point. We score all of your health in real time, 24/7. You remember how I started? It's a stock exchange of your health. Your health has a language, and that's called lifestyle. 80% of your medical outcome is directly driven of your lifestyle. So this is the number one. Number two is what I can understand, I can improve. I live in Zurich, Switzerland. If I wake up in the morning and I see my health score is 650 and everybody else who's 60 like me in Zurich, their health score is 100 points higher, at least I can understand where I am. You now understand that I weigh 100 kilos and I'm 60. So humans, they don't think A, B, or 1 or 2. They think in numbers which are clearly explained. Number three, if I can understand my health score, I can improve it, and the insurance company can help me to improve it. We will announce in New York at the Global ITI Insurance Conference the world's first fully lifestyle-based health insurance. So you get priced in real time. You all know pay as you drive. So one of the first patents I wrote 15 years ago was called pay as you live. So the New York regulator is going to price your health insurance and your life insurance in real time based on the Dacadoo health score. So we are turning the health score into a currency. We're turning the health score into a lifestyle navigator. And that's why we call it Wheel of Life, because you drive through life. I thank you so much, and I was sorry about the, but I hope it worked. Thank you so much.
Peter, thank you so much for sharing that world first with us. How did that feel for you?
Oh my God, I'm still shaking off adrenaline. Oh, no, I was so excited because when you program software,
yes,
you go in the dark room. Of course, you work with your clients.
Yes.
But it was 18 months of work that I showed today, and it's 15 years.
Wow.
And we just spent over 100 million. So my shareholders are
just 100 million.
Yeah.
Just 100 million. You know what? We're so privileged. Not only have you shared that with us, which is phenomenal, but you shared your personal story, your professional story. You come with so much enthusiasm, multilingual.
Yes.
Maybe next time in Arabic as well. But
Yes.
actually, she'll help you out. She'll do the translation. It's been phenomenal to have you as part of our journey here, Peter. And it's beholden on me to say, please come back and give us a progress report. And we want to collaborate and hear from you further. I'm sure I speak for all our audience when I say thank you so much for coming to the M42 main stage.
Thank you.